Good morning, everybody. My name is Irene Norstedt, and I am Director for the People Directorate at DG Research and Innovation. It's a pleasure for me to open this R&I Days workshop on unleashing innovation procurement for health and care. The public procurement for research and innovation is one of the promising ways to address some of the needs in health and care sectors. But the adoption of innovation procurement instruments has been limited so far and rather uneven across the member states. So this is also why we believe that it's important to organize events such as this one, or the Healthcare Innovation Procurement Workshop next week, to raise awareness of calls for proposals and also to help stimulating the uptake of innovation procurement much more widely. Today, I am delighted to welcome 4 panelists who will present how innovation procurement was used for the development of an artificial intelligence prediction algorithm to improve bowel cancer diagnosis in Scotland and to help SME to deploy its robots in more than 10 EU countries. And this one is actually now tipped to become Europe's next unicorn. So in this session, we will hear about their experiences, what the success factors in the process they led were, and what recommendations they have to organizations conducting or supporting innovation procurement at EU, national or regional level. We will also go through questions you might have for our panelists, and for this purpose you can access Slido through the link that is now shared on the screen. And if you please have any questions, etc., or you can also vote for others' questions. That's really important because then they're going to move up the right. So if there are questions you feel are really important, you need to keep on liking them so that they move up the list of questions. And we will see how many of those we will be able to take in these sessions. We will, of course, try to do as many as we can. So with that, I hope that you all are ready to go, that you have downloaded Slido. Please use it. And I will, with that, introduce our first panelist of today, which is Pekka Kahri. And Pekka is a technology officer at Helsinki University Hospital. And he will tell us about the innovation procurement process for the development of this artificial intelligence. It's difficult to say, artificial intelligence prediction algorithm for traumatic brain injury patients. So Pekka, the floor is yours.
Thank you very much, Irene, and good morning, everybody. And greetings from the Finnish archipelago, the wonders of remote working and participation. So I'm happy to be here and present some experiences that we've had in developing AI algorithms and partnering with company partners and using procurement as a tool. So in our hospital, which is the biggest hospital in Finland, covering the secondary care of 1.7 million people in the southern part of Finland around the capital. So we've been quite systematically building capabilities to do AI development, not only research, but also developing them into clinically usable products. And one example where we've done quite a lot of work is around traumatic brain injury. And traumatic brain injury is a very common, unfortunately common cause of death for young and middle-aged people. So in Finland, there are about 1,200 deaths per year. In Europe, about 80,000 deaths per year caused by traumatic brain injury. And even though they are in high quality intensive care, so even 1/3 of the patients will die after this trauma. The problem with traumatic brain injury and its monitoring in the intensive care is that there is a lot of data that is collected from the patient monitors continuously. So hundreds of thousands of data points per each day, per each patient. And in fact, the clinicians are using just a fraction of the collected data. And the prognosis of survival or the development of the status of the patient is traditionally done with the subjective prediction methods. So clinicians, physicians evaluate subjectively how well is this patient doing. So it is an obvious case for AI to support this decision making because there's data that could be used and predicted. On the background, there is, of course, intensive scientific research. Rahul Rai from University Hospital has published scientific papers in a large consortium with several Finnish university hospitals, and now also collaborating with Karolinska University Hospital in Sweden to validate further the algorithm in clinical setting. But how to do these, translate these algorithms from science into clinical practice? So for that we need development partners from the industry or from companies, and therefore the team decided to enter into a procurement process to find the best partners to develop this scientifically proven algorithm into a commercially and clinically available product so that it could be taken into use. And the starting point in Finland to start a procurement process for this type of need was a bit difficult or a bit tricky. The analysis was that if you go into traditional tenders, so opening an open tender and setting the criteria in advance, so we might not end up in a good solution for a few reasons. At least in our case, so there are well-established and large companies that are proposing these tenders, and we're excluding maybe some very potential SMEs or startups who might be very competent but will not succeed in these traditional tenders. The processes are quite lengthy. The AI industry and AI capabilities are very dynamic, and it's difficult to evaluate which company really has the competencies for the task at hand. I need to say that processing this type of hospital data, there are no good references, so because nobody has done it before. So how to evaluate where are the best competencies? And then also, since it is work in progress also in the scientific field, there is quite intensive co-development efforts needed, which make it quite difficult to choose the potential partners. So we decided to go for a tender. It was a formal tendering process, but the key there was to include a broad multidisciplinary team with clinicians, with legal people, and with the IT people in the IT department, and together formulate the tender and then do the tendering in two parts. First, there was a long list of companies based on formal proposals, and then a shortlisted companies made an assignment and interacting with the clinicians, so working partially with the problem. And then based on this assignment, we managed to choose two partners, which are now in fact working together with the clinical teams in developing the final version of the TBI, the traumatic brain injury algorithm. So this is my contribution for this part. I will share on the chat a link to the leading clinicians Twitter page where you can find more details about this, and I'll be happy to engage in discussion with the other panelists. Thank you.
Thank you very much, Pekka, for this interesting case that you put forward here, and we're now looking forward to hear more from other cases, and I will now introduce Katie Cuthbertson. I'm not sure I pronounce your name correctly. Sorry for that. And Gary Robinson. So you are both from the Scottish government, and Gary and Katie will tell us about how they are using innovation procurement process to support the development of better patients' pathways by describing the ScotCap project, which is aimed at redesigning gastroenterology services in Scotland. So Katie and Gary, over to you.
Thank you, Irene, and good morning, everyone. Lovely to be here, and I'm speaking to you from Glasgow this morning. So I'll talk a bit about ScotCap, and I'll pass over to Gary as well in a moment. So the ScotCap project, as Irene said, was really based around trying to remove the bottleneck, the diagnostic bottleneck for GI disease and bowel cancer risk assessment. And in Scotland, we have had pressure in the system, and the demand for bowel cancer diagnostic tests was outstripping the capacity we had for traditional colonoscopy. Therefore, patients were waiting longer than we would want for this test. And that was before COVID-19, so the system was already under pressure, and you can imagine now the pressure has increased. We also wanted to establish whether the innovation partnership approach could be used to improve outcomes of innovation projects in the Scottish public sector, and to determine what lessons we might learn from the initial use of this approach. And therefore the Scottish Procurement and Property Directorate within the Scottish Government created a cross-sectoral group to oversee improvements and outcomes of innovation projects using the appropriate procurement processes. So prior to ScotCap, the forerunner project was the HiCap project, which started in 2017. And this was based in one health board in Scotland, NHS Highland, and that used colon capsule endoscopy in a rural setting. And that was done through the use of a research pre-commercial procurement contract. And thereafter, the ScotCap project commenced, and that used the innovation partnership approach, and that was in 2018, November 2018. And we awarded a contract in May 2019. And that saw the beginning of the evaluation of around 500 patients as part of the ScotCap project. So HiCap and ScotCap have both used a clinically approved diagnostic tool, which is the colon capsule endoscopy. And that was to create this service that could increase this capacity to diagnose bowel cancer. And the colon capsule itself is a small pill the size of a vitamin pill, and the patient swallows it. And as it travels through the patient, images are sent to a belt which the patient wears, and those images are then downloaded, and a report is produced by clinicians who read those reports. So the innovation partnership itself is in two phases. Phase one was around the development and evaluation of the service within NHS Scotland, and that was really around determining the feasibility, desirability and economic viability of the service. And 2 Scottish universities were involved in that, providing external assessment of the service, and that was led by our national clinical lead, Professor Angus Watson from NHS Highland. We established a project board and a project team, and then phase 2 was around the implementation and adoption of the service itself within health boards across Scotland. And towards the end of the evaluation, the ScotCap 500 patient evaluation, COVID-19 hit, and the project board and the project team were asked to rapidly roll out colon capsule endoscopy to more health boards across NHS Scotland. And I'll pass over to Gary.
Good morning, Katie and Irene. Greetings from the very north of Scotland, near John O'Groats. So today we have 5 health boards that are now using the service, with a further 2 health boards due to start over the next month. Over 1,000 procedures have been performed, mainly with symptomatic patients. Further work is ongoing to improve the service and roll out the service further. In terms of the innovation partnership procurement process, we have noted areas of improvement for the next project we use in Scotland. Following on from ScotCap, other projects such as Cytosponge, where we've rolled out to 1,200 patients for upper endoscopy, heart flow, COPD and dermatology have also been established using a variety of appropriate procurement processes. The next innovation partnership is likely to be in pharmacogenomics, hopefully releasing in the next couple of months, using genomics to safely identify patients aged 65 and over at greatest risk from multiple medications, and to produce an efficient, safe and effective medication regime tailored to the changing needs of the patients. Work is ongoing to create improved structures and infrastructure for innovation in Scotland. This has led to the establishment of Katie's team within the Centre of Sustainable Delivery, being tasked with the adoption of innovative services within NHS Scotland. Procurement will continue to actively support the Centre for Sustainable Delivery as we continue to learn from our experiences and improve the delivery of both new services and economic growth in Scotland. Thanks very much. Thank you.
Thank you very much to Kate and Gary. So this was a second example, also very, very interesting. And I just realized it's very early for you guys. Very a head start this morning. I just thought about it when I introduced you. So we're apologizing for that. But I'm really glad that you could make it at this early hour in your case. So thank you very much for doing that. So let me now remind the audience that you can submit your questions in the Slido link. And please do, maybe we can put the link again to Slido in the chat function in case we have some people who have joined us a little bit into the session. So please do put your questions in there for the panel, and we will take those shortly. So I will now introduce our final panelist, and this is Juul Nielsen. He's the CEO of UVD Robotics. And Per will tell us how pre-commercial procurement, in this case led by a group of Danish hospitals, helped his company in his early stages, but also how the company then supported the European Commission's efforts against COVID-19 following a public purchase of innovation process. So Juul, over to you.
Thank you very much, Irene, and good morning, everyone. I'm pleased to have this opportunity to explain about how we have been using the innovation processes, procurement processes within the healthcare industry. I'll just find out how to present this on the right-hand side. Here we go. Yeah, briefly about myself. I've been working in many industries for the last almost 15 years. I've been heading up companies in the healthcare sector, working with different healthcare and medical devices. And now I'm CEO of UVD Robots. I'll come back to that. So briefly, to set the scene, our company belongs to the Blue Ocean Robotics Group. And the Blue Ocean Robotics Group is a robotic development company that has been around since 8 years. And the vision of the company is to develop different service robots based on different type of robotic technologies, but then make or develop and commercialize individual robots, actually providing different kind of services. And these robots are then spun off in individual companies belonging to the group. So we have my company, which is a UVD Robots, a UV disinfection robot. I'll come back to that. We have Gobi Robots, a telepresence communication robot that also is applied in healthcare industry. And we have a PTR robot, which is a patient transfer and rehabilitation robot, just about to hit the market. So this is the background. Let's go back to specifically just UVD Robots. Now, we started actually almost 4 years ago, 3.5, 4 years ago. We are now the global market leader in autonomous UV disinfection. We're headquartered in Denmark. We have more than 80 distributors worldwide. We have regional-based sales teams in the US, Asia Pacific, the Middle East, and Europe. And we are also engaging with large corporate account customers who are deploying our robots in their services and integrating them in the different business models they're having, like ISS, the global cleaning and service company, Novo Nordisk, the life science company, Ecolab, a large infection prevention chemical company. All of them and other companies are now deploying our robots in their services. And that has all happened within a period of 3.5 years. So we have been really growing at a high pace, and it all is coming actually from healthcare innovation procurement processes. So that is quite interesting for today's discussion. So let me go a little back and explain about the background for this company. The background is actually hospital-acquired infections. That is a major problem. Hospital-acquired infections in Europe, we have around 4 million cases per year. 40,000 people are directly dying from those infections, and the costs to the European healthcare system is tremendous, 7 billion euros in cost related to those infections. Most of them are preventable, but we just need to find the right means to deal with that. So that is the background. And it's actually only getting worse because WHO is explaining that, or is forecasting that the hospital-acquired infections will be the biggest single problem in the healthcare industry over the next 10, 20, 30 years. And especially with the increase of antimicrobial resistance, where the current antibiotics can actually not treat many of the infections right now. That means there are no means of treating the infections. So the only solution is to prevent infections from occurring. So that is the background of our company, and that was the background for setting up the innovation procurement process in Denmark. And that was back in 2014-15 actually, where the Danish healthcare system, the 5 healthcare regions, a local university hospital, they made a procurement process for innovation. And the objective was to develop a solution, not at that time specifically defined as a robot, but develop solutions, innovative solutions to resolve the issues with hospital-acquired infections. And if we look at it a little bit more specifically, then it was actually in 14 the pre-commercial procurement process was made from what is called the Sygehuspartnerskabet, which is basically the Danish Association of Healthcare Partners and the 5 regions. And the objective was to develop new innovative solutions that can reduce the spread of infections in hospitals, patient rooms, in ORs. The project was set out in 2 phases. The first phase was to simply uncover the technical possibilities and the commercial potential of the proposed solution. That means finding the concept, finding possible solutions to reduce spread of infections in hospitals. That ended in 2015, March, and then in June, the PCP phase 2 application was submitted, and our company, Blue Earth Robotics, won that tender, and the second phase started. And that took up to 2.5 years, where we actually, from the concept initially, were developing a functional prototype that was operating in the local university hospital here in Odense. And that meant that by December 2017, we had actually a prototype that could work. And since then, it was decided to spin off that technology, put it into a separate company, and that company was UVD Robots. So UVD Robots now, from let's say December 2017, got the role to commercialize, to spread out this solution globally, to help improving hospital-acquired infections all over the world. So that was the birth of the company. And the process took, almost 5 years. Then later on, we actually, from March 2018, were growing all over the world. We were building up our network of distributors, supplying these innovative solutions to hospitals around the world, gradually stepping up in Europe, in Asia, later on also in the United States. But then another interesting innovation procurement process for healthcare industry turned up, and that was with the European Commission. COVID hit really hard in 2020. We all know that. Started in March, April. It really was a serious situation. And we had a product that could actually help prevent the spread of COVID-19 in hospitals and also in other facilities, but particularly in hospitals. And the European Commission were looking at solutions to assist to help European member state hospitals to reduce the number of infections, COVID-19 infections. And that process was initiated. There was made an information gathering process, finding out what systems are available, are they kind of trustworthy, how's the efficacy, and then in June, hospitals in EU member states were asked to request for supplies, donations of these robots to help them fight COVID-19 in their hospitals. And in this procurement process, which was a tender by invitation, we participated in that, and we submitted our tender in October, along with others. It was a kind of a closed tender by invitation only, so we don't know actually who were the other tenders, but we won the tender, and we signed the contract with the European Commission in November about delivering 200 robots to European hospitals, not only delivering, but also making sure those robots were installed, the staff was trained in order to use them in the right way, to have the most effective deployment of the disinfection robots in 200 hospitals. And that started taking place in Q1, where the first robots were rolled out, installed, staff were trained, and that process is still taking place. So every day now, or every week, we are rolling out robots to European member state hospitals in a large scale. So that is, let's say, two very good examples of how the product was invented 5-6 years ago, back in 2015, in one innovation procurement process. And here's a second example of how the innovation procurement process from the European Commission actually can help us grow our company and make sure that a lot of hospitals can benefit from the technology that can help them prevent COVID-19 infections in their facilities. And we as a business can benefit from growing the business, creating more jobs, more employees, and making better lives, and finally, at the end of the day, saving patient lives around Europe in this case. Thank you very much. That was our story.
Thank you very much, Juul. And this is a very interesting story. I mean, of course, very important as well in our fight to COVID. But also, I think it's very interesting to see how you first have benefited from a national procurement, or was it a regional? National, I think, procurement. And then you could further grow and roll out in Europe through the Commission's call for the procurement. So it's an interesting story to see the combination of how these procurement instruments can be used together to grow something. So I think this was interesting from all of you. That completely different cases from 3 different application areas. But all have been using the innovation procurement as a tool. So what I would like to hear from all of you in the panel is a little bit of what would you say have been the success factors and that you could sort of advise others who would like to go for this innovation procurement, and what are any concrete particular recommendations that you would like to give to anybody who is conducting or supporting innovation procurement? Maybe we start with Pekka.
Yeah, thank you. So in our case, where the goal of the development was developing something quite new in a highly dynamic field in AI. So really having some level of agility in the process was really important. So the procurement specialists, together with the clinicians and with the IT team, worked really intensively together throughout the process in order to see that it really meets the even fairly short-term needs of the clinical application. So in this sense, the really bringing some agile ways of working was key in this particular case. And as in all sort of procurement or demand-led innovations, it's really important that the clinical goal and the clinical objective is always extremely clear. What do we want to achieve? And that the problem is really well defined, and the procurement is then used to meet the needs of that particular need. Otherwise, the clinical staff will not be happy, because they might get proposals to something which is not really solving their problem, but maybe something on the side. So maybe that's few thoughts on that.
Mm-hmm. Thank you, Pekka. Katie and Gary, any thoughts from your side?
Thanks, Irene. I'll say a couple of words, and then I'm sure Gary will have more to add. But I suppose for us, it was clinical engagement was key, with the number of different stakeholders around the country as well. We needed strong clinical leadership, which we have. And I mentioned earlier, we have a national clinical lead to really drive the project forward, and that's been a real sort of part of the success of the project. Real commitment and dedicated time in the working week for the clinical lead to support the work and take it forward. Establishing clinical networks as well across the different health boards for the different clinicians in different units, to really try and reach that consensus around clinical protocols, etc. So that's been a key element of it. But I suppose it all, for me, always comes down to communication. You can never communicate enough, and I think that's been a big part of how we've managed to move the project forward. And it's there's been ups and downs, and it's still going on. As Gary mentioned, the work is still being refined, but for me, that's been a big part of why we've managed to get the work to where it is just now. But I'll ask Gary to add his thoughts.
Mm-hmm.
Thanks, Katie and Irene. I agree with everything Katie said there, and also agree with Pekka, the need for an agile way of working, and the need to be focused on solving the societal problem. Two other success factors is the cross-functional working. I think that is required from clinicians, companies in supply chain, economists, statisticians, charities, enterprise agencies, and of course procurement. And then secondly, probably improved governance within and funding to allow the scalability of these services is also important. And probably just the last thing to say is that I think certainly in Scotland we are at the very start of our work on this journey to improve the innovation life cycle, with numbers of projects coming through. So we're learning all the time from the projects we undertake. Thank you.
Thank you very much, Gary. And then Peter Juul, would you like to share your experiences?
Yes, I will. Thank you. Yeah, from our perspective, that means a private corporation. I think it's very important that you keep your eyes open on what kind of tenders are out there, and when you find the right ones, allocate sufficient staff and resources to manage them. And also, I would say, especially working with tenders, and also the tender process here in EU, as a private company, be patient, be systematic, because it is quite bureaucratic, and especially if you're a small company, not having a lot of let's say administrative resources, it can be quite a burden to deal with that. But it is bringing benefits in the end, and it's just a way of working with in this environment. But it just needs to be done in the right way. Allocate the resources, be patient, work systematically. Then it pays off. But it's not just an easy task to do. It requires commitment from the company, from the team you're setting to deal with these projects.
Okay, so thank you, Per Juul. So I think that we have come to a point where we look at Slido, and we hope that there has been questions coming in Slido. So if we could have the Slido questions shown, would be good. And the questions would then appear in the order, starting with the ones with the most likes. And I'm not seeing any questions yet. Here we have. So we have the first question appearing here is, I'd like to hear more about the outcomes and the impact of the projects. Okay, so who would like to come in here?
I can add a bit, Irene, if you'd like, about the ScotCap.
Yeah.
So for ScotCap project, we are working towards trying to achieve around 25% of our new symptomatic patients who are referred who would traditionally have gone for an optical colonoscopy. We're aiming to create the capacity for colon capsule endoscopy to replace 25% of that. And as I said earlier, the system's under pressure in terms of colonoscopy capacity. So that's and part of the reason that we've moved so quickly with colon capsule endoscopy. But that's our aim. So as Gary said, we now have 5 health boards in Scotland out of 14 who have live services, and we've just recently done our 1,000th procedure. So we are moving to roll it out to the rest of the health boards. It takes time, obviously, to establish new services, new ways of working, but ultimately our aim is to achieve between 4,000 and 5,000 procedures per year to support that diagnostic capacity.
Okay. Thank you. That's really interesting to hear. Pekka, would you like to add something?
Yes, so the impact of getting these algorithms into clinical use comes from the volume of intensive care. So in our hospital, for example, in the neurological ICU, there are annually about 300 traumatic brain injury patients, which comes into a cost of about 15 million euros. And with the intensive care, really the choice which is done already today is that who benefits from the intensive care, and where the solution is not to increase intensive care units. And as we know, even during the COVID side, so intensive care is something that should be used where it makes most sense. So these tools will really help in the physicians in doing their work better and assigning the limited resources into those patients who would benefit from it the most. But the clear is that the impact doesn't come unless this is somehow becoming scalable. So a product that could be routinely used in different hospitals, and that's why the scientific and validation collaboration between academic hospitals and ICU centers is really important to really get the impact. So it's an interplay between the scientific and validation, and then making these available for the hospitals.
Mm-hmm. Thank you. Juul, would you like to add something?
Yes, thank you. I think the impact and outcome of innovation procurement processes, I think in our situation, it's obvious, because our product, and then afterwards our company, which is today a global company with basically, I would say something like in our part of the company, maybe 75 people engaged in working with the UV robots, selling them all over the world. That company was simply based on the first innovation, the first procurement process done with the Danish healthcare system back in 2014-15. Had that not taken place, this product had not been existing today, and this company had not been existing today. So I think that is a really great example of an innovation procurement process that can have a huge impact on society and on the welfare and well-being of patients in hospitals. So I think that's a really good example.
Thank you. So I think that your examples has really shown the value of this instrument. This is a rather new instrument, and I saw a question on Slido there, but it has disappeared again. Can we please get the Slido questions back? It's a bit difficult because they jump in and out. So if we could please keep them on the screen, because it helps us to run it. Because we have a good question here about wondering if the Commission are considering to use PCP and PPI. So there we need to say what they are, because it's pre-commercial procurement and procurement, innovation procurement is the second one. Here the question is if we are going to use this to a greater extent for healthcare in our new program Horizon Europe, and the answer is yes. So this instrument was sort of, we started to use it slowly in Horizon 2020, but we are now looking at using this more often, because we think it's a really useful instrument to make sure that healthcare really gets the innovation that they need. Therefore we have put in our work program for 2021, and our work programs has just been published. So you can all go in there and have a look. So we have in the work program 2021, we have put in a topic for what we call a coordination and support action. And this is because we would like to network the healthcare procurers across Europe. And by that, we can also sort of learn more about this instrument, and also to network them, and also share experience in how to use these tools in the best possible way, and hopefully also speed up the procurements, because I have seen some other questions down the line there that sometimes it takes a long time with these procurements. We think that by sort of further increasing the networking, exchanging experiences, etc., more and more will be learned, and therefore we could hopefully speed up. We also do have a specific topic in our work program for 2022 for both PCPs and PPIs, supporting the recovery from COVID. So indeed, we do have topics, and we will, of course, soon start to reflect on the coming work programs. So we're already start to think about the work programs for 2023 and 2024. And we will, of course, see here a little bit how we can use. But we think it's a very interesting instrument to be used as complementing the other topics where you do have sort of new innovative ideas coming forward. And here we're really looking from a need, the need side of what do healthcare really need, and to bring innovation forward through that route. So it is something we are very interested in further expanding and exploring. So we do have the question there, procurement of innovations often take a long time. Any suggestions on how to shorten the time frames? And it says, especially for AI. I'm curious a little bit why especially AI, but I guess it's a question which is directed to you then, Pekka.
Yeah, thank you. So I think that the motivation of the question is quite clear, because AI is such a dynamic field and it evolves so fast. So if you have the process part of it is very lengthy, it might be that the sort of real world drives past because it's developing so fast. I agree that this is when it comes to doing the processes, it takes time. However, our experience is that much of the process time is about waiting. So if we can somehow cut the slack from these processes, it would be really beneficial. But also reminding that medicine, at least when we're talking about critically ill patients and solutions for their treatment, it's good that these developments take time, because only over time you can see whether there is a value and whether the solutions really work in the real life setting. So I agree that the process time or slack from the process should be further, reduced, but then have to accept that these are long-term partnerships with the hospital.
Okay.
That the outcomes are good.
Yeah. Thank you so much, Pekka. I'm afraid we are already at 9:30. So we will have to close the session. I see a lot of questions there. But that actually brings me to actually promote a workshop that we will hold actually next Monday on procurement. And all of you who now has become more interested in the procurement as an instrument and the opportunities that it can bring, we very much would like to welcome you to participate in that workshop, where of course we will explain a little bit more about how it works, and you will also have opportunities to ask more questions. So with this, I would very much like to thank our speakers, Pekka and Juul and Katie and Gary, for sharing your experience to this morning. It was really interesting. I learned a lot from your particular cases. Really fascinating. And I think you have also shown that innovation procurement is really representing a real opportunity to address the real challenges that we do have in health and the care sectors. And we will, as we said, it can really be used. I mean, we now need to look at the recovery of the pandemic, of course, but also how we can modernize the public sector and also to speed up the time to market for businesses and to help bring innovation to the market much faster. So voila, it's something that we will further explore on Monday. So we would like to welcome all of you. It's Monday, the 28th of June that I'm talking about. We will present more the call for proposals that we have. And you also will meet some colleagues from other Director Generals of the Commission who also have experience from this instrument. I hope you can find the registration link in the chat facility. I cannot see it myself, but I was hoping it would go up there. So I would like to thank all of you in the audience to be with us this morning. And last but not least, I would like to thank Orestes and Jerome for having organized this session and for helping to make this event possible. So with that, I say thank you very much. And if you do not see the link in the chat box, you can find it on our website. Thank you so much for joining, and I wish you all a good day. Bye.
Bye.
Bye-bye.